We're Healthwatch Tower Hamlets, and we've been thinking about patient journeys and how we can make them work more efficiently. Local people have told us that the quality of medical services they receive is usually good, but getting seen can be a long and frustrating process, and services don't always work together efficiently. For many people, the journey begins with a GP visit. So we have engaged with people who use GP services in Tower Hamlets. Their experiences with booking appointments and waiting to be seen were mixed. Almost a quarter of patients are seen on the same day, but almost a third wait for more than 1 week, and they tend to think that waiting times are unreasonable. Patients book GP appointments in different ways. Most do it over the phone, some in person, and only 10% online. With so many people calling at the same time, 20% of patients have found it difficult to book appointments over the phone. They may choose to queue at the surgery before opening instead, but this will often increase the pressure on reception staff, making everyone more unhappy. Online booking is often not an option. Most surgeries only allow it for routine appointments weeks in advance. And what happens to those who cannot get an urgent appointment? We have also interviewed people who went to A&E and the Urgent Treatment Centre at the Royal London Hospital. Going directly to A&E or calling an ambulance was the first choice for less than half of those service users. A third of all attempted to contact their GP. 10% called 111. Only 5% went directly to the Urgent Treatment Centre. 29% of those who tried to talk to their GP could not get an appointment, so they turned up in the urgent care instead. Others were advised by their GPs to access urgent care services, sometimes because the GPs didn't have the facilities or equipment to diagnose and treat them. Some of those who turned up directly at A&E felt that their issue could have been resolved in primary care, but getting a GP appointment was so difficult they didn't even bother trying. Minor injuries and suspected fractures were the number one reason why people accessed urgent care. More than 80% of those who accessed urgent care went to the hospital A&E. 28% of them were redirected to the Urgent Treatment Centre. In turn, 17% of those who turned up at the Urgent Treatment Centre were redirected to A&E. Is this the most efficient way of doing things? What if improving digital access and integrating services could make things easier for patients, reducing pressure on urgent care services and on individual GP surgeries? Some GP surgeries allocate a specific number of slots to routine and emergency appointments, and then triage patients to see which kind they need. We found that this way of doing things does not help patient satisfaction with bookings and waiting times. More popular with patients was the Doctor First system, in which surgeries try and deal with all patients on a daily basis. Everyone gets a phone call from a doctor, but those who need to be seen in person are called in on the same day. But it too has its drawbacks. It's not practical for working people who must be available on the phone all day, and its exclusive reliance on telephone lines means that it may be very busy. Offering online consultations using a video chat app could be a solution, but not all surgeries may have the capacity to offer them. But should they? GP hubs, one in each locality, could centralise and serve all online appointments in the borough instead. GP hubs could co-locate under the same roof with other services, psychotherapists, dentists, social workers, or advice charities. They could be enhanced with facilities to perform urgent blood tests, x-rays, and treat minor injuries. We asked people who went to the Royal London A&E or to the Urgent Treatment Centre whether their problem could have been addressed elsewhere, starting with online telephone consultation and enhanced GP hubs. As you can see, this could significantly reduce the pressure on A&E and the Urgent Treatment Centre and make services all round more efficient. Engaging with a large number of people over the past 2 years, we learned that more than half would have an online consultation with a GP. much fewer have actually done it. Younger people, healthier people, those who worked, those fluent in English were more likely to be interested. Patients who were older, of ethnic minorities or disabled were less interested. Online consultations may not be suitable or accessible for everyone, but helping some patients online may free up extra capacity for those who have to be seen in person, improving access for all. Do you think integrated hubs and online consultations are a good idea? Would you see a GP online? Let's talk about it.